All right. Well, first I want to start by saying, Dave, would you always please present before me? You make my job so much easier because you cover so many of the principles that are really important and open the door for why affective states are also important to consider in the treatment of chronic pain. So for my talk, I'm going to just touch on the concept of resilience. We'll talk a little bit about the role of positive emotions in patients with chronic pain. We'll touch on a subject that Rick brought up yesterday about considering our patients in subgroups and as really not being all the same. And then I will hopefully spend the bulk of my talk sharing interventions with you that are easily deployed by anybody. All righty, so what is resilience? So resilience requires adversity. Without adversity, we don't even know what our ability is to bounce back. And this adversity is really what makes us powerful, what makes us fierce. As Nietzsche said, that which does not kill me will make me stronger. There is a lot of truth in that. But we need these resilience factors to be able to handle these slings and arrows that come our direction. There are many of them. I've listed some of my faves. Positive self-image, having a sense of who you are and that you're competent in the world is really important, as is having a good, strong social support network around you. And positive relations, not just a number of people, but people, you can have just 2 people or 1 person in your life, and that can be adequate as long as that person's incredibly supportive. Oops. Coping problems, or I'm sorry, be able to cope well and do good problem-solving skills, having those on board are incredible, as is just having a general store of positive emotions to help balance out the negative emotions that come with adversity. Communication skills are important. You need to be able to convey to others when you need help. And also, what is the nature of the problem? Just being able to process and talk about something bad that's happened to you can be incredibly powerful. The crux of PTSD treatment is telling the story and being able to reconceptualize it over time. Perspective, being able to put whatever happens to you in perspective. And while it might be huge and bad, what we do as humans is something called downward social comparison, where we think, okay, I just got a really bad diagnosis, but it's not terminal cancer. Other people have it worse than I do, and that helps us cope with bad news or bad events. Having a sense of purpose. If you really kind of know what's meaningful to you and where you're going in life, when bad things come your way, you think, okay, I can weather this. It's going to be a bump, but I know where I'm going. And then also optimism. Perhaps one of the best predictors of good outcomes in health and mental health is optimism. As an illustration, we published a study recently that Dan and I worked on with the folks at the Research Facility Laboratory for the U.S. Army. And what we looked at is 20,734 U.S. Army soldiers who were assessed at baseline for many characteristics, including depression, anxiety, optimism, social support, on and on. And then they tracked these soldiers over their deployment or deployments. And afterwards, we examined what was the incidence of new pain in these several areas of the body that we were assessing, and then what might predict it. And what we found is that about 37% of the soldiers returned with at least 1 new area of chronic pain post-deployment. But interestingly, we found that optimism was one of the only positive predictors of the psychological variables. And what we found is when we compared the highest individuals with optimism to the lowest with optimism, and we found that those who had the lowest levels of optimism were had 35 times the odds of developing pain in a new area. And what was remarkable about that is this was despite controlling for combat exposures such as seeing dead bodies, discharging your weapon, being injured yourself, having multiple deployments, and then certainly all of the demographic factors. So optimism had this powerful effect beyond all these things individuals experienced. But I'm going to focus predominantly on positive emotions. Positive emotions play an interesting role in chronic pain. To help us get a context for this, we as psychologists have done a fabulous job exploring negative emotions. Actually, across the board, that is kind of our bailiwick. What goes wrong with people, right? We're very good at understanding sadness and fear and anger and guilt and all these negative affective states. And while these are incredibly important and something that we absolutely do consider throughout, because they are so highly associated with all the things we don't want in our chronic pain patients, such as pain sensitivity, greater use of medication, lower levels of quality of life, and on and on. We as human beings have a whole other set of emotions that aren't as well understood or explored by scientists and psychologists. These emotions are the ones that we hope to have more of. Happiness, love, calm, enthusiasm, joy, determination, passion. These are all the things that make life rich and also help us bounce back when adversity comes our way. These are important in chronic pain as well. Here's another list of studies that may be equally or even more impressive than those for negative affect. We see in prospective and experimental studies that higher levels of positive affect are protective for the experience of pain, pain sensitivity, greater pain tolerance, earlier discharge from hospital, greater analgesia, on and on and on. Everything we want to see is associated with positive emotions. But to give you some context of where we stand with chronic pain patients and their levels of negative emotions and positive emotions, something we refer to as affective balance, these are all scores from the positive and negative affect schedule, which is the most commonly used assessment tool for looking at affective states. And you see here highlighted in green the scores for healthy individuals. So healthy individuals tend to score on negative affect a score around 18. Okay, we want to see low scores. Okay, high scores are bad. On positive affect, we want to see high scores. High scores are good, and so a healthy individual scores about 35. A simple way to think about this is kind of a 2-to-1 ratio, twice as much positive affect as negative affect, and that looks pretty healthy. When we look at patients with osteoarthritis, they're pretty much kind of in there. Their negative affect was a little lower, positive affect was a little lower, but there's still kind of that 2-to-1 ratio. This starts to look a little bit different with lupus patients, where we see 22, so you see a little elevation on the negative affect and a little depletion on positive affect. But where it gets interesting is our patients with fibromyalgia, chronic low back pain, and chronic pelvic pain. These more centralized pain states tend to have this very low concomitant positive affective states. So when we look at the worst of the group, chronic pelvic pain, this is our one of our data sets, we saw almost an even distribution, not 2-to-1, 1-to-1, very, very low positive affect and very high negative affect. So this is something we need to contend with and think about, how do we utilize these interventions? And I have kind of a real life example for you. Oh, excuse me, I want to back up real quick. Part of the explanation for why this might be so is it appears that there may be a reward processing disruption in the brains of patients, at least those with fibromyalgia who have been pretty well studied. It appears that pain, at least in chronic pain conditions, might be mediated by kind of these neural adaptations in reward processing, which really kind of leads to a reward deficiency, where something kind of wonderful happens and it's like, meh. Or even kind of a sense of anhedonia, right? That just everything is kind of really blah. And even a lack of motivation to seek positive things or even be aware of positive things. And so here is kind of my real life example. So we concocted this crazy intervention that was therapist-less and involved piggy banks. And so what we do is we give patients a piggy bank, and they're really festive and cute, and some have tutus, and they're brightly colored and delightful. We give them a bunch of slips of paper, a pen, and a positive reflection card. We laminate a little card with these instructions. We say, every evening, think about the people, things, or events that made you happy that day. You may make a list if you like. Pick one of these and spend a moment savoring it. What made it so special to you? Now, write down this moment on a currency slip, one of those little pieces of paper. Use enough detail that you can immediately recall what happened later. Next, add a date, fold up your happy memory slip, and pop it into the piggy bank. What we then instruct them to do is, after a circumscribed period of time, we tell them to open up the piggy bank and withdraw their little currency and read each and every one of these. The thought is that once they review these happy memory slips, that there would be kind of a burst of positive affect. We tested this initially in a little general population sample that we screened for depression, very, very low depression symptoms, so kind of healthy and happy already. And what we found is that these individuals who did the positive piggy bank compared to our waitlist control actually had improved life satisfaction, which is a cognitive element of well-being. Then we tested this in an unusual setting. We tested this in a small pilot in breast cancer surgery patients. These are women in a couple of weeks before they were ready to undergo breast cancer surgery who did the positive piggy bank. And then the night before surgery, we called them on the phone and said, open up your piggy banks and read the little slips. And even with this teeny tiny sample, we found that on the morning of surgery, those in the positive piggy bank arm had lower levels of negative affect, they reported less fatigue, and improved subjective well-being. So even this little group, they had a great response. We were happy to see that. Then we tested it in chronic pain patients. We found a nice stable state to start. These were all patients who were undergoing epidural steroid injections, so we kind of had a single intervention that was happening. And then we had them do the positive piggy bank for 30 days afterwards. And what we observed were no changes. Nothing happened. We were surprised, disappointed, and scratched our heads and thought, what on earth? And when we were digging into the slips a little bit, I think, Manisha, you might have even pointed this out. It was somebody who was entering our slips and said, yeah, these are looking weird. And so just to remind you, the instructions are every evening think about the people, things, and events that made you happy that day. Make a list if you like. Pick one of these, spend a moment savoring it, and write it down. Well, these are some of the responses we got from our chronic pain patients. It has not been a good day. I'm happy to have a home to be unhappy in. I cannot express the pain I'm in. So sick of taking pain meds, but I'm not giving up. Rough night, couldn't sleep, up all night, maybe tomorrow will be better. Third day in bed, I'm sad. That's the best thing that happened all day. And today, my brother's 61st birthday, nothing to be happy about, he passed away. So if these are the happiest reflection you are having on a particular day, there's a chance that perhaps you are not seeking positive things in your environment. And so we're rethinking how we do this in some of our patients. Some of them, I say, because others of our patients did this very well and appeared to benefit. So this leads me to all of our patients are not the same. And just our little illustration of this, at the Back and Pain Center, we take data from every new patient that walks in. We have a number of clinical measures that they complete as well as validated measures to assess pain and affect and functioning. This information is fed back to physicians before they see the patients, and they have this kind of nice profile about levels of catastrophizing and on and on. From this data, we conducted a cluster analysis with 4,700 patients looking at pain severity, positive and negative affect, depression and anxiety, and catastrophizing. And what we found is kind of 3 different groups. These are almost kind of by severity. There was no shocking things in here other than the differences. So in the first group, we call these folks distressed. It's accounted for about 1,300. These patients had high levels of pain, lots of depression and anxiety, catastrophizing over the moon, really high levels of negative affect. Look at that, 33 negative. Remember, that's supposed to be 18. And really low levels of positive affect. Remember, we want to see that about 35. So this is actually a flip, 2 to 1. Then we had a group of patients who were kind of what we call struggling, right? They had a lot of pain, but they had kind of mild depression and mild anxiety. Catastrophizing, not terrible. Their negative affect was slightly elevated, but their positive affect was quite low, unusually low. And then lastly, and I really want to point this group out, 1,600 of our patients probably look like most of us on these same measures, other than the pain, hopefully. They had relatively high pain, 5.5 is pain not to be sneezed at, but very low levels of depression and anxiety, very little catastrophizing, very low negative affect, right? Remember 18, so they're lower than the norm, and almost normal positive affect. So this tells us, we're dealing with very different patients than just when we look at a normal sample. And some of these patients may respond to the interventions better than others. We can't tell you that yet. We're working on that. But my general thought is these interventions can't hurt our patients. That is what we see. And we know that patients with chronic pain tend to give up the things that they value in life most, just so they can do the things they have to do. Verboeuf refer to these as our valued life activities. The joy just gets lost in life, right? People are just doing the bare minimum to survive. And as Dave was mentioning with pleasant activity scheduling, this is an effort to try and bring these things back in their lives. And with these little interventions I'll show you now, these are little things you can use to help them maybe find a little bit of joy again. So these are positive emotion and resilience interventions that are all evidence-based. I'll show you some of the data for each of them and things that you can certainly try. So first of all, I like to kind of have a resilience building plan. What are the things we want to target? And when we look at a list of these things that we want to impart to our patients, we want them to be able to recognize personal signs of stress. We want them to be able to focus on physical hardiness, get them walking, get them exercising. We want to strengthen the relaxation response. We want them to be able to self-calm and relax. We want to counter unhelpful thinking. This is kind of the catastrophizing realm. And what we know is CBT gets at these beautifully. Where we want to fill in some of the blanks are some of these other things that can really enhance resilience, such as increasing optimism, identifying and using patients' personal strengths. We all have our strengths. Often we don't know necessarily really what they are. Increasing positive emotions on a daily basis, interventions like the piggy bank we talked about. Improving our social support and engaging in meaningful life activities. So how do we do this? So we use positive activity interventions. These are little, simple interventions that have shown to increase our happiness. Things like gratitude activities, like keeping a gratitude diary, conducting acts of kindness, savoring, being very mindful and being able to enjoy a pleasant experience, my victorious self, which I'll tell you about in a moment, creating meaning in life, giving little gifts, positive service, volunteering, forgiving someone, not carrying around that grudge, and having understanding our strengths and our values better. So I'll talk to you about some of them since my time is limited here. These could be important. We know that in the general population that these positive activity interventions usually given together, because sometimes when just tested alone there's not enough power, kind of like CBT, where we want to do a series of things to improve the intervention, not just rely on one activity. But what we see is that in a general population, these positive activity interventions do improve subjective well-being and psychological well-being and decrease feelings of depression. And another meta-analysis also found that depression is decreased and well-being is increased. In patients with pain, there's been a couple of studies where this is still kind of a new area. In a study conducted by Madeline Peters and her group, they found similar improvement in depression compared to cognitive behavioral therapy program for these positive activities. They found that benefits persisted at 6 months, and patients with higher levels of education actually did better at these positive activity interventions or fared better than the CBT arm. Another study by Basili looked at positive activity interventions compared to waitlist control and found that the folks in the positive activity interventions had higher levels of happiness, greater optimism, positive future expectations, positive affect, and so on. So they had a very positive response. But there are some caveats. So in a recently published study by Leslie Hausman and her colleagues, and something that we had commented on, they tested a positive activity intervention series of studies in older veterans with osteoarthritis. They looked at 360 vets and did a 6-week positive activity intervention and followed up with them, and what they found is nothing. This randomized controlled trial really showed that these individuals did not benefit. The comments we made is that we will need to tailor these because 60 and 70-year-old veterans may not appreciate some of these types of activity interventions. It might just be a generational and even just a guy thing predominantly. So when we look at a resilience building plan, these are the pieces that I called out before might be particularly amenable to positive activity interventions. We look at enhancing optimism first, and this is best possible self. This has been shown to be a really nice way to enhance optimism and a cool thing that you guys should try yourselves. So best possible self says to take a few minutes to select a future time period, could be a year from now, 10 years from now, and imagine that time you're experiencing your best possible self. Imagine it in detail, where you've worked hard and succeeded at accomplishing your life goals, or hitting an important milestone, or realizing one of your life dreams. The point is not to think unrealistic fantasies, but really think about things that are positive and attainable for you within reason. So really create, what would this look like for you? Think about it, be with it, feel it, and then write about it. There's something very powerful in translating kind of these positive visions through writing into a journal. A way to identify and use our character strengths. This is probably the most commonly used intervention. First, a bit about character strengths. We all have them. These, to some degree, almost make us superhuman, right? These are our little secret things that are unique and special about us, but if you don't know what they are, you can't use them. Character strengths themselves are ordered by virtues in the darker series there: wisdom, courage, humanity, justice, temperance, and transcendence. And then the character strengths themselves stem from those. So in wisdom, you see the character strengths of creativity, curiosity, judgment, love of learning, and perspective. Okay, all of these lovely strengths can be found. And they are assessed by the VIA website. This is free. This is a nonprofit organization that uses this data for research. They literally have, I think, a couple million individuals now who have completed this. What it does is you just sign up. It spits it out a PDF for you at no charge, or for your patient, and it will tell you what your character strengths are, and also down the line things that you may want to work on. What we do with our patients is we tell them, based on our strengths test, write your top 7 strengths down, and every day for the next week use one of these strengths in a new way that you've not used before. Each night write down how you used one of your strengths that day, including what strength you used, how you felt before, during, and after the activity, and whether you plan to repeat that in the future. Okay, and so the example we give is, let's say creativity is one of your strengths and you're an artist. You use it to paint. Well, how about if we were to use creativity in an entirely different realm, like use creativity in problem solving with trying to get your children out the door in the morning, right? So how do we use this in new ways? Excuse me. So increasing positive emotions on a daily basis. This is probably my favorite. I love to try and teach our patients how to become more aware of all the positive things out there in the world for them to see. We mentioned the positive piggy bank. We now have adapted this to make this a positive gratitude bank. It appears that the data shows that our patients might be better at gratitude. Since gratitude takes happy out of it, gratitude is probably the easiest emotion for us to conjure up out of the blue. So we do the gratitude book, but you can also do happiness. And a true gratitude diary is kept as such. There's many different ways. The way that we use it in our interventions is we tell folks that every day, usually at the end of the day, think about the things that they're grateful for, write them down, write 3 of them down on usually in a journal. The rub is that these things need to be different every day. And what happens is after about the first 5 days, you run out of the biggies: family, friends, my dogs, happiness, health. And then you start getting into the real things in the world and looking around for what makes you happy. All of a sudden, that chocolate chip cookie is like something you're really digging because you can write it down that night, or that beautiful flower, or that sunset. You know, many of these smaller life choices that maybe we kind of look over are now kind of brought to our attention. And as Dave mentioned, pleasant activity scheduling. This is borrowed from cognitive behavioral therapy. And as a standalone intervention, this is probably the most powerful of the bunch. There was a review that found that the effect size in treating depression was 0.87, which is crazy high. That's a really powerful intervention. Just getting people to regularly schedule, put on their calendar things that they love to do, and they're actually going to do it, and treat it with the seriousness that they would treat a doctor's appointment or something else of value. Savoring is another positive activity. We direct our folks that every day for the next week, be sure to savor at least 2 experiences. For example, your morning coffee, a moment with a friend, sun on your face, your walk to the car, a shower. And take the time to say, oh, this is wonderful. Engage your senses. What do you feel? What do you smell? What's it like to be here? We encourage our patients also, when they're having these psychosocial or these social moments with people, take a mental picture of that. Remember what it feels like to be loved or cared for or engaged. And when you're having a great moment, we need to help our patients solidify these into the arsenal of all this other negativity to help balance that out. Improving social support, absolutely key. How am I on time?
3 more minutes.
Oh, okay, we won't do. I was going to have you do this experiment. We'll do this later. We invite people to text and connect. So using our cell phones, which tend to really mess up our social relationships, to use them for good. And text somebody that you haven't talked to in a long time. Write them a little note. let them know that you're thinking about them, you care about them, reconnect, and use that for good. I was going to have you do that now, but do it during break. How's that sound? And you get a bonus point if you send a picture of the two of you together, because that, that connection can really help. I have my students do this, and they tell me that, oh my gosh, I can't believe who I reconnected with. It was amazing. So try and do this. Acts of kindness, going out there and conducting random acts of kindness. The way this works best by the literature is by doing 5 acts in one day. That's the very best way to do this as far as really boosting happiness. Just doing 1 act a day doesn't seem to do much. In doing it this way, the data are great for conducting acts of kindness. It helps decrease levels of health-related stress, less depression, lower levels of pain, lower levels of cortisol across the board. Acts of kindness are powerful medicine. And these are my students out there doing acts of kindness. And then lastly, engage in meaningful activities. We need to have purpose in life. And I think when I did clinical work with patients, when they did best is when they kind of found their new purpose, right? They get derailed when they're hit with chronic pain. And finding this new direction is incredibly powerful. Our purpose in life really guides our decisions, it sets our goals, it offers our direction, and it gives our lives meaning. Purpose in life also is really strongly supported by the research. People who have high levels of purpose in life have less depression and anxiety, healthier aging, better sleep, better immune response, increased willpower. Across the board, purpose in life is very powerful. It's also a really important thing for us to have, and it takes a while to get there. Here's my data. And this I leave you to play with your purpose in life if you don't feel it, you've nailed it down, or to share with your patients. What you do is you put in the red box the things that you love, in the other red box, that which the world needs, in the next red box, that which you can be paid for, and that which you are good at. And examine those things. How do they come together? Does it help you solidify, what you think is your purpose in life, or help you start charting the course? Many of us take years to develop this, but if we have a sense of where we're going, we do much better. So to kind of close on this, we are working on making these positive activity interventions a greater part of cognitive behavioral therapy. They already are in mindfulness-based stress reduction and acceptance and commitment therapy. And what Dave and I are doing, we have an R01 to test an intervention that we call PRISM. It enhances cognitive behavioral therapy that we deliver online. It's coached by medical assistants who are working from one of those lovely treatment therapist manuals. And we're conducting a randomized controlled trial to compare standard online electronic CBT to our enhanced version, eCBT, with these resilience interventions, and treatment as usual. And you can kind of see here how we've woven in signature strength, savoring, positive piggy bank, and acts of kindness into standard eCBT. Dave mentioned that Fiber Guide is live now, and if you don't want to wait 4 years for our results, Happify has something that I developed for them. This is a positive activity intervention for chronic pain. We developed specifically, last time I checked, it was still free. And that's kind of a neat thing where patients can try out some of these interventions I spoke about. And with that, I will close and thank the people who make my work possible and the funders.